Now, although South Africa has achieved significant progress in its COVID-19 vaccine drive, many unvaccinated people remain vulnerable to infection. Scientific research has shown that vaccines are currently the most potent weapon we have to fight this pandemic. Yet vaccine hesitancy and misinformation continue to hinder the public health work being done. The National Institute for Communicable Diseases has recorded a total of 3,699 new COVID-19 cases in the past 24 hours. With a further 300 COVID-19 related deaths being reported, bringing total fatalities now to 85,302. Well, to talk more about South Africa's vaccine drive and its access for all communities, we are joined by Rehad Desai, who is the spokesperson for the People's Vaccine Campaign. Rehad, welcome. Good to have you on the show.
Thank you.
Talk to me about the People's Vaccine Campaign. What's this all about?
Really, we set up in early January this year under the understanding and agreement that what we needed for the vaccine to arrive, to get it here on time and to be administered and to be rolled out, was to ensure that government's actions were as appropriate as possible, that they were connected to what's happening in the locales, in the various communities up and down the country, that they were connecting to people's fears and concerns, and that the vaccine sites, firstly, we would get the supply, and secondly, once the supply was there, the vaccine sites were set up, staffed in a way which is convenient as possible for people, as close as possible to where people live. The queues weren't too big, that there were enough staff on hand. That we are insisting that some childcare facilities available. We know there's lots of single young mothers who need to take their children to the vaccine sites with them, some facility there, and that the communication about where these vaccine sites are, when they're open, people having time off for work and so on. Vaccine access issues is what we call them. And then also in the last few months, 2-3 months, we've been embarking on a very big training program to ensure that people understand the vaccines. We can't do it alone. We need government to do this as well. It's a difficult job. And what we're finding is that people, it's not only in South Africa but internationally, need peer-to-peer education, face-to-face education. They need to hear it from trusted sources in their communities, the churches, the community-based organisations,
Indeed, and that's the thing, is getting the message close to people, and they can make the decision for themselves as well. Not sure if we've lost you. It looks like your screen may have frozen. Are you still with us? Can you hear me, Rehad? All right, looks like that connection is having a bit of a problem. But the reality is that we're here to provide the information, and this is quite an important aspect of the vaccination process, is to give people the information. And it takes time for some people. Some people are much easier to adapt to it and go and have the vaccination done. Other people like to take it slow and see for themselves whether or not that's something that they want to or don't want to do. So throughout our time here on air, this is what we're trying to do, is give you the information that you need to make up your mind either way. And that's what most experts are, of course, saying, is that it is better to be vaccinated. It does help, and that the more people that are vaccinated, the better it is for this world to get over the coronavirus and get back to normal, whatever a new normal looks like. But we're here just to give you that information. All right, let's try and get that connection up and running, but let me bring you this in the meantime. Only